Why cook? We live in an era where you can go to almost any street corner and find food that is made for you fairly quickly, simply, and relatively inexpensively, and you don't have to bother cooking at home or cleaning up dishes. But it's really not a coincidence that the majority of my patients don't cook. By the way, I'm a weight loss surgeon. This is what I do for a living. And what that means is simply this, that those patients eat out. And that means they eat fast food or eat at chain restaurants. And that means that they eat crap. It also means that they eat too much. Patients of mine who are successful at losing weight and keeping it off learn to cook. And they not only learn to cook, they learn to cook well. You probably already know some people who've had gastric bypass or lap band surgery and they've regained their weight. And oftentimes they blame the operation, saying the surgery just didn't work for them, instead of blaming themselves for falling back into old habits, which is typically eating out and eating junk. Or maybe you've even known of a heart surgery patient who goes through and gets their chest split and gets all new coronary artery vessels, but then goes back to eating the same old burgers and cheese that they did before. Or the cancer patient who says, I don't like chemotherapy, I don't want chemotherapy, but thinks nothing about the crap that they're eating in restaurants. This is my goal, teaching my patients how to cook great food. It's not only good for your body, but a great and lovely hobby. My recipe is to teach you some very simple recipes that are going to provide you with some great flavors, with healthy food, and often things that maybe even conventional wisdom will say aren't healthy, but actually are. Like one of my favorite delicacies is the skin, the crispy skin from chicken. Most people are kind of intimidated by cooking, and the cooking shows don't help. I love watching Iron Chef, and it's amazing what they can make in 1 hour, but all that's kind of yuppie food. What we instead want is something that is simple food. So here's my proposition. Learn to cook one new thing a month. That's it. One recipe. Learn to cook it and learn to cook it well. And then the next month, learn something else. You'll practice it a lot, and eventually you'll get it to where you can cook it and eat it. And you're going to find some things that you will love it and your family will love it. So what we're going to do is we're going to go through a month-by-month process. And every month you're going to learn to cook a new and different thing. You're going to learn to cook it well. You're going to learn to cook things that you never knew that you could cook so well before. By the end of the year, you're going to have 12 new meals to cook. And by the end of 2 years, you will have replaced all the crap that you have eaten before with great food, cooked properly, cooked by you. And your family and friends are always going to want you to do the cooking for them because they'll like the way you make rack of lamb. Or when you make eggs, they won't be rubbery and be used as a Super Bowl. But the real reason you're learning to cook, it's for you. Because if you learn to cook, and you learn to cook the healthy food that tastes delicious, it will keep you out of my operating room. Now, don't worry about me. I have plenty to do. But I want you to be successful in your weight loss journey. Whether you're my patient or someone else's patient, the bottom line is learn to cook. And when you learn to cook, you'll enjoy what you're doing. You'll become good at it. Everybody will enjoy doing it. And you will cook your way to health and better nutrition. I'm Dr. Terry Simpson, and that's your doctor's orders.